Welcome to the introductory lecture on environmental health. In this lecture, we will talk about the principle of environmental health, followed by some examples of environmental health hazards. Before we proceed with the definition of environmental health, let us revisit the definition of health. The World Health Organization has defined the terminology, health, as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This means that a person without a disease is not necessarily healthy. He or she should also have a sense of well-being from the physical, mental, and social point of view. Environment is everything that is external to an individual host. It can be a physical environment, a biological environment, or a social environment. It is basically everything that can influence a person's health status in a population. If we combine the definitions of health and environment together, environmental health means that those aspects of human health that are determined by physical, biological, social, and psychosocial factors in the environment. Environmental health as a discipline refers to the theory and practice of assessing, correcting, controlling, and preventing those factors in the environment that can potentially affect adversely the health of present and future generations. So, what are the environmental factors that can affect humans' health? Let us look at some of these factors. Noise can affect human being physically and psychologically. Hazardous noise is usually present in the workplace environment. Workplace hazardous noise exposure can cause occupational noise-induced hearing loss. Hence, it is very important to control the noise level of the workplace in order to prevent workers from hearing loss. Improper disposal of domestic and industrial solid waste causes environmental pollutions, such as water and air pollution. Solid waste contains hazardous chemicals, harmful biological agents, sharps, and other hazardous materials. It will cause harmful effects to humans' health when people are in contact with it, as shown in this picture. Solid waste will decompose and generate a type of toxic liquid substance called leachate. Leachate will pollute underground water and indirectly affects humans' health. Similarly, improper disposal and management of solid waste will affect humans' health indirectly through water pollution and generation of hazardous gases that pollute the air. Air pollution is caused by the presence of excessive amount of hazardous gases, chemicals, or dusts in the air, to an extent that it cannot be effectively diluted by natural air circulation. The common air pollutants are dusts, sulfur dioxides, oxides of nitrogen, carbon monoxide, and ground-level ozone. In this picture, you can see the air is filled with coal dust. Air pollution causes respiratory and mucous membrane irritations, and is associated with acute exacerbation of respiratory diseases, such as asthma, chronic bronchitis, emphysema, and many more. Studies have shown that air pollution is associated with increases mortality among the vulnerable group of the population, such as those with cardiovascular and respiratory diseases. Flooding, which is common and seasonal in our country, can cause significant water pollution to the affected areas. Children playing in the flood are at risk of drowning and getting waterborne diseases, such as cholera and typhoid. Communicable diseases, such as COVID-19, SARS, MERS-CoV, Ebola, and tuberculosis, are considered environmental health issues. Zoonotic exposure, globalization, international traveling, crowded spaces, human interactions, and sociocultural activities are environmental factors contributing to the spread and occurrence of epidemic and pandemic of communicable diseases. Man-made intentional or unintentional accidents, such as atomic bombing during World War II, Chernobyl and Fukushima nuclear power plant explosion disaster, and many other radiation-related accidents, give rise hazardous environmental radiation exposure, which can cause death, radiation-related diseases, and cancers. Some industrial activities use water as the coolant to reduce the temperature of some industrial processes. If the hot water from the cooling processes is released into the natural water bodies nearby, it will cause thermal pollution to the rivers, ponds, or lakes. The hot water will reduce the water oxygen content and give rise to the death of aquatic animals and change of ecosystem and food chain. Road traffic accidents and all other forms of accidents cause bodily injury and death. This is one of the important environmental health issues. Urban planning, public education, community and workplace safety and health management, healthcare support system planning, and disaster and emergency response system are all important to ensure public safety and reduce the impact of accidents to population's health. Urban poor is another important environmental health issues. Problems surrounding urban poor includes overcrowding, poor sanitation, food and shelter insecurity, mental and social health problems, safety issues, and communicable diseases problem. These are also considered environmental health issues affecting humans' health, requiring multi-agency collaboration to solve the problems. Environmental health issues also cover social-cultural problems affecting the health of the population, such as marginalization and cultural shock, population overcrowding and poverty, and social displacement. Internally and externally displaced populations are a major public health problem to the recipient countries worldwide. Hence, in general, we can classify environmental health hazards into 5 categories, namely physical, chemical, biological, biomechanical, and psychosocial hazards. This categorization is slightly different from occupational health hazards. In occupational health hazards, natural disaster, or non-occupationally related road traffic accidents are not considered related to the course of work. Now, who are the people most affected by environmental issues? The vulnerable population are women, children, elderly people, ethnic minorities, disabled people, indigenous people, and those with low socioeconomic status. These population groups are vulnerable because of genetics and lack of empowerment to change their environment. So, what is a healthy environment? Yossi suggested that a healthy environment should at least contains clean air, safe and sufficient water, safe and adequate food, safe and peaceful settlements, and stable global environment. These criteria, although simple and straightforward, are quite difficult to achieve altogether. In general, managing environmental health-related problems require a process of risk assessment, followed by risk management. Whenever we face an environmental health issue, we have to define the problem clearly. Then, we have to measure the magnitude of the problem and understand the key factors related to the issue. After we have assessed the risk and understand the issue, we have to develop appropriate interventional or prevention strategies. In most of the situation, the resources are limited, and hence, setting policy and priority for strategies is almost always needed. Implementation of managing strategies should always be followed by evaluation process, to review, revise, and continuously improve the strategies, so that the issue can be solved. The interventions deployed in handling the environmental health issue can be generally classified into 3 different models. The first model is called Clinical Intervention Model. The figure shown in this slide explains the interaction between the human, environment, and the occurrence of diseases. Human in the environment unavoidably will affect the natural order of the environment. Environmental pollution, man-made disasters, and other adverse environmental conditions will in turn affect human being, contributing to the development of diseases or injury. The illnesses, if not treated, or if become too severe, may end up death. In the clinical intervention model, the intervention is targeted at treated the diseases or injuries caused by the environmental health hazards. In most cases, these treatments are not effective, because they are individualized, and probably too late. The second model is called Public Health Intervention Model. In this model, the intervention is aimed at preventing environmental hazards from causing diseases or injuries to the population. For example, during the haze period, Ministry of Health is working very hard to educate the vulnerable population to stay indoor, wear masks, and avoid open burning, to reduce the health risk of haze in the population. This interventional model approach is better than clinical intervention model, but still not ideal. The third intervention model is called Environmental Stewardship Model. In this model, the intervention is aimed at changing the behavior of human, to protect the environment, so that it is safe to be inhabited. This is the best interventional approach to prevent environmental health problem as a larger scale. However, this interventional approach is also the most challenging one, because human behavior is extremely difficult to change, needless to say, in a collective manner, and global scale. Nevertheless, all environmental health practitioners worldwide are still working towards changing humans' behavior to protect our environment. In Malaysia, we have a lot of programs to control, or prevent environmental health problems. These include enforcement programs, environmental water and air monitoring programs, and environmental pollution prevention programs. One of the main laws related to the environmental protection in Malaysia is Environmental Quality Act 1974. There are a lot of regulations under this act. These regulations as the rules and enforcement guidance in various fields and aspects of environmental protection. Besides, monitoring programs and legislations, the Ministry of Natural Resources and Environment also initiated many education, training, and incentive programs to promote awareness among the population to protect our environment. For example, the program Rekan Alam Sekitar is a program to develop awareness and mobilize community in environmental preservation and restoration activities. Seminars, workshops, symposiums, and many more types of training and educational programs are organized by the Ministry of Natural Resources and Environment regularly, build the capacity of environmental protection practitioners in our country. The ministry also provides incentives to the companies who adopt green technology in their production activities. The Ministry of Health has devised the National Environmental Health Action Plan to strengthen the environmental health activities in our country. This plan is divided into 7 aspects, namely water, sanitation and hygiene management, solid waste management, air quality management, health impact assessment, climate change management, toxic waste management, and environmental emergency preparedness and response. These action plans are carried out by the Ministry of Health via multi-agency collaborations. In summary, environmental health is a very broad subject. Healthcare personnel plays an important role in implementing and supporting the environmental health activities in this country. Environmental health is one of the subspecialties under the discipline of public health. Thank you.